We also learned this week that Travis County has identified its first measles case this year.
As KXAN's Grace Reader explains, measles is extremely contagious, and public health officials are looking to make sure it does not spread.
After traveling internationally, Austin Public Health says a man ended up at this emergency room in North Austin earlier this week. He tested positive for measles. It's the first case of measles reported in Travis County this year. APH is now investigating and gave us some insight into what that looks like.
There's a 10-page questionnaire that the state has, and it goes through a host of questions, whether that could be like any places that you group places that you may have been exposed, whether you've traveled. We look at vaccination status.
Austin Public Health says this man was not vaccinated. Now, before you panic, the co-chair of the Texas Public Health Coalition says Texas is not seeing the same caliber of issue that we did last year.
As of right now, according to our state health services, there have been, well, as of last week, 9 different counties that have had a case or cases of measles, and now with Travis County having a case, it's now up to 10.
So you may be wondering, what exactly is measles? The most well-known symptom, the rash. The pictures are not exactly pleasant to look at. Other symptoms include
fever of up to 105 degrees Fahrenheit. You'll also hear things called the 3 C's, which stands for cough, coryza, which is a runny nose or stuffed up nose, and conjunctivitis, which is red and itchy eyes.
APH says measles is highly contagious, spread through the air when a contaminated person coughs or sneezes. The disease can linger in the air or on surfaces for hours.
90% of the people who are in the room with a person who are unvaccinated will become sick.
So not getting measles probably sounds pretty good, right? Best way to protect yourself against it? Vaccination, APH says. You may have already been vaccinated for measles at a young age. So if you got vaccinated as a kid, you got the 2 doses, you're good to go. You don't need to go get another vaccine.
That is correct.
Excellent. As for the people who may have come in contact with measles, here, APH says they're reaching out to those folks. But if you believe you've been exposed to the disease, you're asked to contact your doctor and not go out in public. Grace Reader, KXAN News.
And APH says the man who was infectious was at St. David's Emergency Center off of Highway 183 this past Monday from 11 a.m. to 1:30 p.m. They say measles symptoms appear roughly 1 to 2 weeks after someone makes contact with the virus.